Okay, good morning. My name is Josh Wickman. This is the Care Continuum podcast, episode 3. We have a great guest. I'm really excited to welcome Joyce Griggs with the United States of Healthcare, and just wanted to kind of get some ideas, some healthcare trends, about what we're seeing today and what she's seeing specifically in her, area of expertise. So, Joyce, great to see you, and how you doing today?
I'm great. Thank you so much for having me. I'm looking forward to the conversation.
Of course, of course. And Joyce is calling from Athens, Greece. So it's always
Mhm.
good to get the perspective from someone across the pond, especially. But obviously,
Mhm.
I've been following, what you're building with the United States of Healthcare,
Mm.
especially, your perspective on patient advocacy. And not a lot of people, at least over here, are talking about it and positioning it this way.
Mhm.
Can you kind of expand on, and you can just introduce it and expand on kind of what you've been doing,
Sure.
how the idea came about, and why you're
Mhm.
so passionate about it as well.
Sure, sure. So, I worked in healthcare marketing for many years. So I was very close to the development of medicines and how that comes to be, and working with thought leaders who were actually running these trials that were creating life-saving medicines. And so I was very close to all of that. And in 2017, my former husband had knee replacement surgery. And so I thought, okay, I'm going to be able to help him navigate all the things he's going to need to navigate. And ultimately, what happened was he had some complications with other conditions, and I was asking for him to get a certain level of care. And I thought I was doing a good job of saying what it was we needed and raising red flags. Um, but it still wasn't enough. I made certain assumptions about how I was going to be responded to, and I was wrong. I mean, it was categorically wrong. And there was when you have knee replacement surgery in the US, you go home the same day.
Mhm.
And we had home health aides, that were brought to us by the hospital. So they give you a lot of care in home. And there were some great nurses who I was talking about what some of our issues were, and they really helped me to see what I needed to do in order to properly advocate for George and for our family, and get us what we needed. And I began to realize, if it's this difficult for me, someone who knows a lot about how things work, then how do normal people, everyday people, how do they get through this without having, grave difficulties and maybe serious life-threatening situations that can be avoided? So that gave birth to United States of Healthcare, so that I could help people with what became known, in the way I speak about it, health self-advocacy, and in a broader sense of what does that mean? It's not just what we do at the visit with the clinicians in our lives, but how do we connect the dots with our own healthcare teams? Because even with routine care, we have a team. You have a pharmacist that you see probably 5 times a week. You have a dentist, a primary care physician. Women, we have OBGYNs, a dermatologist. So right there, there's five. And do they know everything about you, and how is your care connected? So that's where I come from. I sit above any condition, so I'm not connected to any specific condition. What I bring in with the United States of Healthcare is helping everyone with how can they coordinate their care in a way that makes sense for themselves and their lives.
No, absolutely, and that's a great point, and that's a great personal, background story that illustrates, quite frankly, what some of the gaps are in
Yeah.
our healthcare system. And the average person who, would go and get whether it's a knee replacement or some type of elective surgery, even cosmetic, whatever,
Yeah.
what have you. I think that, you people, and this has been going on, for forever really, is, the doctor's the expert, right? So I'm just
Mhm.
going to um, trust him or her wholeheartedly to
Mhm.
know that they have, my best in mind. And unfortunately, that's just sometimes that's not the the case. And there's a lot of external factors. There's a lot of um, compromise might be a strong word, but you've seen it as far as like they're influenced one way or another by some product or some like something that they're maybe selling or influenced to do that doesn't necessarily jive with what's best for that specific patient. And so if you just put all the 100% of your trust in doctors, it should theoretically work out for you. But that's unfortunately that's sometimes not the case, and I think that it perfectly illustrates that.
Mm-hmm.
And a lot of people don't realize, how fragmented healthcare really
Mm-hmm.
is.
Yes.
And I guess as far as you kind of went over some of the gaps um, that you see in the health system, feeling like
Mm-hmm.
something needed to change. I guess where does the biggest disconnect exist today across the care continuum?
Well, I mean, there's a lot in what there's a lot in what you said. So medicine is, in my opinion, is generalized. So
Yeah,
we talk about personalized medicine, um, and what you need to do to get personalized medicine from a biological and a physiological point of view. What I talk about is personalized medicine from your actual everyday life point of view, because a treatment plan, like let's say you and I have, or me and another woman who looks identical to me demographically, have exactly the same condition. Well, exactly the same treatment may or may not, and let's just say biologically, physiologically, same treatment is indicated. But in terms of the way we live our lives and the pressures that may be in my life versus the other woman's life, one treatment plan may not work for another. And so when we say the doctor is the expert or the nurse practitioner, whomever you're seeing, it's true, they're the expert on your team. But in the end, we are the expert of ourselves.
yep.
And so we need to bring these things up and put them in the forefront of the minds of our clinicians so that they take these things into account, because clinicians will take more into account. They'll take, well, doc, my symptoms are a little bit different than these generalized symptoms that are, usually congruent with this condition. And so it's really, the system is the problem.
Hmm.
I don't even want to say that it's the clinicians that are the problem. It's the system that are the problem. And we're all trying to work within this system, which is time limited in terms of what's available to us. And then, we don't talk about it this way in the US, but in fact, the care is rationed. Healthcare is rationed in the US in terms of what's on a form takes a lot of effort. And what happens to women in particular, and I don't mean to leave men out of this, but this is what happens to women.
Yep.
There's a lot of invisible work that on women. So it does sound like I'm asking more of people. All I'm saying is you're already doing a lot of work. Now it's opening the eyes to, okay, well, how does the system really work? And what are some of the things that I can do to get what's best for me
No.
from the system?
Yeah. Yeah. No. And that's really what it should be about. It's not a one healthcare is not a one
Mhm.
size fits all solution. I think everything has to be taken into account. And I think that sometimes, these doctors, they're trained to, okay, if this is what something looks like, whether it's a knee with arthritis that's getting, it could
Mhm.
be anything, then like, okay, that's what's happening, then this is the solution.
Yeah.
But I mean, there could be listen, there could be like a 67-year-old who has a great knee, and I'm using knees as an example,
Yeah.
who might not have the amount of, osteoarthritis that, a 48-year-old has, but like, oh, the 48-year-old's younger, and you just have to take everything into consideration, the activity level, the BMI, everything. And what
everything.
you said about women as well, because there's those extra few specialties, such as OB-GYNs that need to understand this as well. And I think that if you just go into a doctor's office and kind of do whatever they say, and just kind of don't
Mm.
fight for yourself or advocate, you could it becomes it can become a problem. And I think that
Yeah,
is where you are doing some great work, and it's just helping just spread the awareness of this is so important, right?
it is.
Because people, especially with the cost of healthcare, which will come up here shortly,
Mm.
you want to at least get the bang for your buck, right?
Mm. Yeah,
And so you're
exactly.
spending a lot of money, and if you're the one size fits all solution is not working for you, then that's already a sunk cost, and then you have to try to get out of that. So there's so many different examples of this really across our country, and as far as ways to fix it, I mean, it's a very nuanced conversation. Um, so yeah, and that's great as far as be able to kind of shed light on that. Everyone talks about um, I guess first I have a question. Do you think it's more related to like incentives, communication, infrastructure? Like, what do you think is the main culprit behind this big problem in our country's healthcare system?
The problem of communication between patients and clinicians, or
Yeah, yeah. I mean, and just whether it's yeah, that's the communication I'm talking about. Do you think it's
Mhm.
incentives from healthcare providers? Like, what do you
I,
think if
I,
you had to pick
I,
a main
I
culprit here?
I think it's sort of clear, like, so I like look at it as like, okay, let's talk about the visit, right?
Hmm.
And how does one prepare for a visit? Do you prepare for the visit by getting there on time? Or do you prepare for the visit and that's it? And
Right.
showing up and that's that?
That's what many people
Or
do. Yeah.
a lot of us.
Yeah.
Or do you prepare for the visit by making a list of all the things that have been concerning you? From that, then looking at what are the priorities? This is what we talk about in terms of, I'm just looking at the visit because that's the thing where there's the most pain, but it leads to better care. So if you prepare for that visit, come with your agenda. If some people don't like talking to the doctor in that way. They're reticent about it. Hand it to them on a piece of paper. Doesn't matter if it's handwritten or typed, doesn't matter. Send it in advance if you know that's the way it works with that practice. Then you have the conversation. The clinician knows what's important to you. And I always say, ask a question in the visit, even if the question is, can you please repeat that one more time? And can you just, you were using a lot of jargon. If that were the case, could you say it in plain English? Or let me say it back to you. I want to make sure I
Yeah.
understood, right? To slow it down. And then what I also say is take a few minutes right after the visit. Now I know we're always pressed for time, but I'm saying sit in that waiting room for 1 minute if you can and just reflect and make some notes about what happened in that visit and what has to happen next. And then the thing that I talk about a lot is, and this is because others have brought it to my attention, between visit communication. So, okay, you gave me this plan, even if it's just exercise more. This is how I'm going about it. Do you have other resources for me? Because, the first thing we do, right? Dr. Google, Dr. AI. And then in comes all this really unfiltered information.
Hmm.
We don't even know if it's balanced or not. Now, people are going to do it. I'm not saying don't do it. Everyone's going to do it. What I'm saying is ask your healthcare provider for resources first before consulting Dr. Google, Dr. AI, and then
Hmm.
bring that package to Dr. Google, Dr. AI, and
Hmm.
say, these are the things that I've been instructed to do. These are the materials I've been, websites, from verified sources like
Hmm.
Mayo or Cleveland Clinic or some of these
Yeah.
other, right? And then say, okay, help me to understand what are the top three things that I need to be focused on. And so begin to limit that. So these are some of the things that we speak about in terms of a repeatable plan that you can put over. this, okay, it's not the greatest system on earth. Look, I'm fond of saying in the United States, you can get the best health care anywhere on planet Earth if you can figure out how to get it.
Yep. Yeah, no, that's a great point. And making sure that you're prepared for a visit, like any other, like
Hmm.
anything else, any other meeting that you go to,
Absolutely.
is really important. And I think that sometimes you need the doctor to explain it to you like you're five, and
Yes.
and sometimes that's easier said than done because a lot of I think that intimidation, and
Mm.
even if it's subconscious, is a big deal here,
Hmm. Of course.
because you're confiding in an expert who, oh, he's done this before, he's seen this, wholehearted, you know trust, which a lot of them do deserve, quite frankly, with the amount of
Yeah.
schooling and whatever. But make them earn it, I think, is kind of what we're getting at here,
Well,
because I think that the average doctor is looking, they're I think some of them might, and it's a good thing, right? If a doctor, not maybe rolls their eyes is the wrong term, but if they have to work harder in your visit because they actually have to customize your care, answer your questions, um, and say to themselves, "Oh, this patient, they showed up, they're prepared," And I think that
exactly.
there's a level of respect too that comes from that, from the doctor. And I'm sure you've seen that as well.
Hmm.
But as far as everyone talks about patient-centered care.
Hmm.
Operationally, I think that's hard to execute. What does actually a good patient experience look like in in a real system? Because I think a lot of the busiest doctors who have the best names, and oh, locally, I'm in Chicago, right? Like, oh, that doctor, I'm just gonna throw him out there, orthopedic surgeons, because I know them best. Dr. Brian Cole. Nothing bad to say about him. I mean, he's the most well-known surgeon in Chicago, takes care of the Chicago Bears, Chicago White Sox. He has all those names. He's an MBA as well, has a lot of business ventures, but like his at Midwest Orthopedics at Rush. Now, he, just as an example, like I think you get like 10 minutes, 5, 10 minutes, because he has so many patients per day. And then now, granted, that's a teaching institution, so he has residents in there too. But like if you're
Yeah.
looking to go see him, and you don't have, questions, or it's a typical visit, like you're really not going to get much hands-on. So I guess that goes back to my question. What do you think actually good patient experience looks like in a real system?
I mean, I
It's a loaded question as well.
I'm probably going to oversimplify it,
Yes, please
because
do.
there are
No, please do.
so many things that go
Hmm.
into it, and there are people out there today that are working on,
Hmm.
real problems in terms of interoperability of the different records that follow a patient, and so on and so forth, because there is no real coordination of
Hmm.
our information. I think that what makes a good experience is knowing what I need to be responsible for. I need to know that I have a personal health record, however I decide to keep it. I need to know that I have a well done family history that I update. I need to know that how to prepare for a visit that works for me, so that I get the health care that I need and deserve, and I get heard. That's the other thing that I would say, is that there has to be a willingness, and this is difficult, especially for people who are non-assertive, to ask what and why until you have clarity,
Hmm.
and on any issue. And I think these are the things that we can do as individuals. There are many things that need to be done on the system level to fix some of these things. But for example, like just using the example of going to the top orthopedic surgeon in Chicago, and I can sort of identify with that. I had a double simultaneous hip replacement surgery
Okay, there you go.
3 years
Bilateral hip.
ago.
Yep.
And I
Yep.
had to pick an orthopedic surgeon, and I interviewed three orthopedic surgeons, and one of them was the top orthopedic surgeon here in Greece, who has a global following, right? He's a global thought leader in
Hmm.
orthopedics. And when I was speaking with my physical therapist about choosing a doctor, she said, "Look, you want to choose a doctor that's done a lot of women. You want to," and we started making a list that was specific to me.
Hmm.
I'm not a Chicago Bear.
Yes.
Uh,
Yeah. Right. Right.
right. So,
Yeah.
so it's like, these are the things that we have to think about. So sometimes the best person for you is the person who's more aligned with
Hmm.
who you are. And I mean, physiologically and biologically, and how many, in my case, I looked at, okay, this guy's done a lot of women my age, active women who want to stay active, and
Hmm.
so on and so forth. And I had a great outcome.
Great, great, and that's what I think is important here as well, because especially in, I mean, I'm sure in Athens, but in Chicago, where you have options, right? Anywhere you have options, you can do. That's where you can utilize, Google and AI, which we'll get to soon about, kind of and doing some research and talking, word of mouth, and not just like choosing the closest or whatever. I think you just need to understand that you have options, and controlling the controllables, I think, is an
Yeah,
important
that's right.
concept for me in life. Controlling the controllables, right? Because you can get a lot of anxiety about things you can't control, as everyone can do in work, professionally, and in life. But I think that where you do have control is you can uh you can ask the appropriate questions about, before you choose a provider. And then once you get there, if you have a list of things that, and I think that that comes down to, if a doctor or his staff can answer your questions and
Yeah,
repeat themselves, and like make sure that that their bedside manner
yeah,
is appropriate for patients who just want to understand what's going on, because the vast majority of them don't come from a healthcare background,
yeah,
and they
exactly.
don't know really what's going on. And so that, I think that's what kind of what you're getting at, and what I've seen as well, is actually good patient experience,
Yeah,
getting your
I think
questions answered.
so.
And yeah, yeah.
And one of the things, you mentioned, like interviewing a doctor. Like if you're looking for a new doctor, we do have on our website, we have a lot of free resources, and one of them is an interview guide. Now there are 13 questions in this guide. You don't have to ask all of them, but if you are looking for a new doctor, um, I tell people all the time, make appointments. Okay, you might have to pay for it, but it's worth it to sit down
Hmm.
and have an interview with that doctor, even if, and this happens to some of us because of the way we're insured, you only have one choice. Go and sit down
Hmm.
fully clothed, not sitting in the paper gown on the exam table, asking them questions and finding out more about who they are, because maybe they don't have the bedside manner that you would prefer, but maybe they're your only choice. So at least you know what you've gotten yourself into. At least okay, this person makes me feel uncomfortable. So there's some things
Hmm.
that I'm going to need to do when I'm communicating with them, because this is their communication style. So this is what I say to people: the more we can equip ourselves to deal with whatever the situation is that's in front of us and face those realities, the better off we will be in terms of taking care of ourselves.
Yep. Yep. No doubt. No doubt. And I think that all the above is important, as far as being your best patient advocate, for yourself, because at the end of the day, that's really what, you have to kind of make yourself the main character, right? You're the most
Yeah,
in this situation. You have to have that main character syndrome, and you have to fight for yourself, because a lot of times, especially when you're an adult, there's not people fighting for you. And now your ex-husband was lucky, clearly, because you were
he
doing the
was, and
Lord's
he
work
knows
for
it.
him, right? You were doing the Lord's work, but not a lot of people have that, have that going for them. So that's important. And I just wanted to transition to data, as far as like the data in healthcare. Obviously, a shortage of there's a shortage of usable insight. There's no shortage of data. But as far as, how do you think the role of data uh, is improving? What do you think about the role of data in improving care delivery? And do you think it's gotten better? Maybe a little too convoluted sometimes. Where do you think it's data is improving, care delivery on a
Mhm.
macro scale?
You mean data in terms of
Like
patient
patient data,
outcomes
yeah, like
in
patient outcomes, and other yeah, and as far as like how it relates to the quality of care that patients are getting. Like coming from a doctor's perspective, coming from a provider's perspective as well.
I'm not sure that I really have a handle on that in order to answer to really say. The only thing that I can say is that if those outcome data are based on a generalized population, so I focus a lot on women and
Right.
women advocating for themselves in healthcare because there is a lot of unexamined bias when it comes to women in the healthcare we get, especially as it relates to women's care.
Hmm.
Because, for example, OBGYNs, okay, it's not a requirement if when you are in that specialty, when you are being educated, it is not a requirement to learn about menopause.
Hmm.
Now, I found this shocking, but this is the truism of medical education in medical schools in the United States of America and globally. And so it's an elective. Now, I, I'm not overstating this. Any woman who lives to see her 45th birthday and beyond is going to go into menopause. I mean, it
Hmm.
is a given
Yeah.
unless you're a medical anomaly. So this is the point. So the point I'm trying to make, and maybe I'm winding up too much on this pitch, but the idea is that so outcomes, well, what are these data based upon? Are right now it's very difficult for women to get hormone replacement therapy because of bad data and under education. So I don't know how I feel about generalized data. I don't know
Yeah.
what to say.
Yeah. Well, a better question is about AI. Obviously, there's a ton of
Mhm.
noise about AI. And
Yeah.
from your perspective and experience, where do you think AI actually moves the needle in healthcare,
Uh,
versus just fluff?
So I am an optimist, and
Hmm.
I've been watching what's been happening with AI for a number of years as a person on the sidelines, very interested in what's been happening. And so I've already seen like there was just some data out of South Africa where they've come up with an AI ally who is walking AIDS patients, right, people with
Hmm.
HIV through that whole process of choosing therapies, staying on therapies. And so there is a lot of, we didn't mention this, but there are professional patient advocates that one could bring onto your healthcare team if you have the
Hmm.
resources to do so, especially if you have complicated conditions. And these people can walk alongside you through a very fragmented system.
Hmm.
Imagine AI now being able to do this so that we begin to democratize the ability to have someone by your side as you're making these even if it's for a one-off surgery like some of the surgeries we've been speaking about in terms of joint replacement, or if it's for an ongoing chronic condition
Yep.
that you need to live with for the rest of your life, or a cancer diagnosis, more serious diagnoses, autoimmune diseases, which disproportionately impact women. So I see, not to mention the very near future, I think, of digital clones, which would allow for personalized medicine because then they can begin to, clinicians can begin to quote unquote experiment on the digital clone to see what combination is going to work, what therapeutic combination is going to work in any given case. So I think there's a lot of promise here and can help to democratize
Yeah,
care.
absolutely. And I agree. I mean, I think some of these possibilities are pretty endless and it's like scary almost, but
Mhm.
it's also, I think, a net positive thing. Like I think that society and the healthcare system, specifically what we're talking about right now, I think will, because the social media, just as an example, social media became kind of had gotten out of hand, and then people kind of adapted to the daily, cadence with social media. And I think that I can see that same thing happening in the future with AI. Now, I mean, really, the biggest, the most concerned about AI I am is has nothing to do with what we're talking about. It's more of kids in school and using it to do everything for them and the
Yeah,
learning
well,
curve there.
exactly.
But that's a different story.
That's a
But as
different
far as
story.
health, yes, no, it is, and we can talk a lot about that. But we'll stay focused here about where it is helping, about healthcare, because if you can have if you have an AI agent that knows everything about your past, and you could tell it as much as you want to, and it kind of gathers that information and uses it to give you, advice, which it's, starting to do at a really, really high level. That could really help, and it could really change the game, and make make these doctors earn it even more, for lack of a better term, and
Well, make the
make
system
the
earn it. I
system,
think the
yeah,
doctors want to give it to us. If they were allowed to have
yes,
more time with us in the exam
yes,
room,
no,
then we would get
exactly,
it, you know? I mean,
exactly.
it's
Well, that's a
uh,
different story. I think that, because, and I've seen it, like when my dad has, you know, 40 patients in an afternoon, and he even says, like, it's or 40 patients a day or whatever it is. It says
mhm.
it's way too many. And
Oh,
he wishes, instead of like that, whatever, 15 minutes, he could have like 5 or 10 more minutes, because he really, like, and a
exactly.
lot of these doctors feel this way. They want to give them more care. Now, when you work for an IDN, though, when you work for a health network, sometimes they limit that because they want to get as many patients in and out that door as possible. And the healthcare networks, they don't want the patients to necessarily ask questions, because that takes more time for their doctors,
Mhm.
and so, and they kind of, when you work for the network, which is worth billions of dollars usually, then, you kind of are, it is what it is, and there's nothing you can really
Yeah.
do about it. But I think that, no, I think AI can do, obviously a lot of different things. But as far as, one thing that I've seen, working with specialty clinics, for example, is even, small improvements in patient access and front end visibility. And this could
Mhm.
have a huge downstream impact. Um, but most groups struggle there. So
Mhm.
let me zoom out for a second, ask you a couple, higher level questions, and I'll let you go. If you could realign incentives across healthcare tomorrow, what do you think is the first thing you would change to actually improve outcomes? And I know we've obviously talked about a few, but what was like the first
Mhm.
thing that you would change?
Mhm. I mean, the first thing I would change is the amount of time that a patient and doctor can spend together in conversation, because that will change everything. I think that it would be important to have practices where it's up to the practice that's saying to the patient, here's what we want you to do to prepare for these visits. Here's how we're going to communicate with you between visits. Why should it have to be on the burden, of the patient? And I would say health self-advocacy is an
Hmm.
essential life skill, and it needs to be taught to us some, in some way. It needs to be integrated into our education as human beings, and I'm not sure where that happens on, the continuum of life, but it needs to
Hmm.
happen at the same time that we're learning about, financial management. And I see this as something that large employers can begin to take on. Large employers like the big tech companies and others who have all these souls, in their care. They offer them, right? I mean, I have a friend who works for Microsoft, at the
Hmm.
mothership. You never have to leave that campus because they have everything that you need there, right? From
Right.
dry cleaners to childcare. Well,
Hmm.
why not a way to help people when you're giving them their health benefits, a way to be their own health advocate, and
Yeah.
show them what are the steps that they can take that are going to make a big difference, and to look at it holistically, not just what happens in the clinical encounter, but what are all the things around that that you need to have in place. When was the last time that you put a HIPAA form uh, in play?
Hmm. Hmm. Yeah. It's not standard practice, I guess, anymore.
It's not standard practice in
Yeah.
families, and it
Yeah.
needs to
Yeah.
be.
No, it does. You're right. Absolutely right, Joyce. I'd say for, for your business, United States of healthcare, what would you say are some of the biggest challenges that you have run into as far as, your day to day, but also, business growth, client acquisition, like that type of thing? What would you say
Mhm.
are some of the bigger challenges?
I need to plug in my computer. Hang on just 1 second.
Yep.
There we go. I mean, I would say that in terms of challenges for me and for what it is that I'm doing,
Hmm.
it really just has to do with reaching people with something that is something that we need that we don't know that we need.
Yep.
And so
Yep.
this becomes,
Hmm.
until we need it, and then it's an emergency, and so that's the biggest thing for me, is just beginning to find a platform for what it means to be our own health advocate, and why it's so important, and why what I have these, sort of 8 essential pillars of health self-advocacy kind of need to be, pulled through. That's my challenge. That,
Okay.
that's that's my
Okay.
challenge.
Yeah, no, absolutely. And just as far as like, that comes with like networking and kind of doing everything, I
Yeah.
guess that yeah.
Partnerships,
Yep. Hmm.
affiliations, people who want to say, yeah, that it is really important because, because what I talk about connects to so much of what happens in healthcare. You can connect at so many different levels,
No, absolutely. Absolutely.
Yeah.
So yeah, I mean, I have a few more, but honestly, I think that I really enjoyed this conversation. I just wanted to first ask you if you had any, questions for me, any other thoughts, that you wanted to get into before we wrap up here.
No, I think we covered a lot, and I really appreciate the opportunity to talk with you. It was a fun conversation. I really enjoyed it.
Yeah, no, this was great. This was great, Joyce, and I really appreciate you taking the time today. This was a great conversation. I think that you know, as far as um, as far as one thing you mentioned that stood out, was really from coming from the women's side and coming from
Mhm.
your specific experience about how how sometimes there's not the awareness as far as what you can really do. I think that a lot of people just don't understand fully like what they're capable of, that they don't think that they need to do certain preparation,
Yeah,
certain research before, because well, they're the experts,
that's right.
well, you can become an expert, and you don't have to spend that much time doing it. I think that's where AI is helping out, and I think that that's stuck with me. I think because I've seen that show up in some of the conversations I've been a part of. um I would love to, and I'll send this to you, but I'm not, looking to pitch anything, but if you're open to, I'd be curious to do a follow-up, with you and kind of dive in deeper to your business and how you're approaching it. There might be a few ideas or pathways that I feel like could maybe, help save time, accelerate some of what you're working on. Would you be open to having a follow-up chat as well?
Sure, sure, sure,
Okay.
sure.
Okay, great. Great. Well, anyways, I'll maybe like sometime next week, and we can do that over email. But
Yeah,
I really appreciate your expertise, your time, and yeah, I'm looking forward to kind of diving deeper in, and we'll go from there.
great. Thanks so much, Josh. Let me know when you're going to post this as well.
Yes, absolutely. Will do. Will do. I will
Okay.
follow up later today.
Okay, thanks. All right.
Thank you.
Okay.
Thank you,
All right.
Joyce. Have a great day.
You too. Bye-bye.
Thanks. Bye.